Hello, this is Dr. David Green, CEO of the Colorado Pain Network. The topic today is the top 10 ways to avoid the need for joint replacement. What exactly is arthritis? It's the number one leading cause of disability in America. Over 50 million Americans are affected. It involves inflammation of one or more of your joints, with the main symptoms being joint pain, stiffness, and typically it gets worse with age. There are two main types of arthritis: osteoarthritis, which is wear and tear arthritis, or rheumatoid arthritis. Over 1 million joint replacements are performed in the U.S. every year. Hospital stays usually entail 2 to 4 days for a hip or knee replacement. Knees usually do very well. 90% are doing okay after 10 years. 85% of artificial knees still work well after 20 years. The average age for a knee replacement is 70 years. 60% are women, so slightly more women than men. Infection rate is 1 to 2%. There's a slight risk of blood clots, and there's about a 90% satisfaction rate after the procedure. It is a quality of life procedure. Shoulder, hip, knee replacement, none of these are mandatory. They don't have to be done, okay? Because the implants do not last forever, it's advisable to wait as long as possible to undergo a joint replacement. You get a joint replacement when you're 50, maybe it lasts 15 years or so, then you have to get a revision at 65. The revisions never do as well as the initial procedure. The implants are made of composites with titanium, cobalt chrome, stainless steel, ceramic material possibly, and the inner part, such as you see here for the shoulder, the part that the ball and the socket is plastic. It's polyethylene. So treatment option number one to avoid a joint replacement is activity avoidance. The old saying goes, if it hurts, don't do it, or do it less. You know, if you normally play golf 4 or 5 times a week, maybe cut it back to 2 or 3 times a week. You know, it might put less stress on your joints. The other option is if you do it and it hurts, like jogging, switch to swimming or cycling, okay? That's the first option, very simple. Second is over-the-counter medications, and this may include nonsteroidal anti-inflammatories that are now available over-the-counter, such as ibuprofen, which is your friendly Advil, naproxen, diclofenac. There's plenty that are available over the counter as well. Tylenol over the counter, and then glucosamine and chondroitin sulfate are called nutraceuticals. You can get them at your health food store. Walmart has them. The theory is that they are able to help preserve some of the cartilage that you have and also help you grow more. Large-scale studies are still not available for that. There are some smaller ones that do show some excellent pain relief. Treatment option number 3 is prescription medications. This may include topical prescription pain creams, which have shown to be extremely helpful. High-dose nonsteroidal anti-inflammatories. So if you like your anti-inflammatory but you want a higher dose, you can get a prescription for that. Celebrex is a second-line drug you see here. It's a COX-2 inhibitor. It's more expensive than the regular nonsteroidals, but it can be very helpful for someone who has stomach issues or kidney issues because it doesn't affect those. Short-term opiates. Long-term opiates are a bad idea for degenerative arthritis, maybe for rheumatoid arthritis, but short-term is best. That way you avoid the constipation issues too much or the addiction or tolerance. Option number 4 involves TENS units. These are battery-powered devices about the size of an iPod that go on your belt. They provide low-dose electrical stimulation through these electrodes, and they attach to these foam pads which go on the painful area, and they change the way the brain perceives pain by emitting these slight electrical impulses through the skin. They can be worn 2 hours on, 2 hours off, a lot of time throughout the day. No drugs, no needles. They're excellent. Treatment option number 5 is to lose weight. This is really applying to if you're talking about weight-bearing joints, such as the hip, the knee, the ankle. Less joint stress means less potential damage to weight-bearing joints. So if you weigh less, you put less weight through the surface area of the joint, and it can help a lot with pain relief. Losing weight with exercise may also strengthen up the muscles around the arthritic joint, lessening pain as well. Treatment option number 6 is physical therapy. And this, as mentioned, strengthens muscles around the joints, and that can help take pressure off the joint itself. Physical therapy usually includes modalities such as ultrasound and electrical stimulation, and then stretching is also critical to physical therapy as well. Acupuncture. Studies continue to come out showing how great acupuncture is for relieving the pain from arthritis. Time and time again, in joints all over the body, acupuncture is being shown to have significant benefit. Steroid injections are number 8. It's never been proven that steroids damage human joint cartilage. The only time that was shown was in smaller animals. Even when they went to larger animals, it wasn't shown that they caused damage. So they've been used for decades for treating joint arthritis, typically given every 3 months as necessary. They don't do anything to alter the disease process. So they just provide pain relief, anti-inflammation, and that's it. Treatment number 9 is hyaluronic acid injections. These are made from rooster combs, and the hyaluronic acid is chemically very similar to what's naturally in your joint anyway. The theory is that it helps replace the, quote, motor oil, unquote, in the joint, and that it can also provide pain relief that way, and also help to promote the formation of more cartilage. This has not been proven, but the clinical results are over 65% good to excellent for 6 to 12 months. And treatment option number 10 involves regenerative medicine injections. And this includes platelet-rich plasma therapy and stem cell injections. PRP therapy has been looked at in several recent studies, one at a hospital for special surgery for knees that showed over 75% good to excellent results. They only gave one injection for the study, and they followed these folks for a year, and the vast majority of them did extremely well. Now, stem cell injections are either from bone marrow, fat, or amniotic derived, and they've also been shown to do extremely well. There's no large-scale studies out yet, but if you're trying to avoid a joint replacement, these have very low risk, and they can actually help repair the arthritic tissue as opposed to just provide pain relief. PRP therapy is the same thing, except it doesn't have stem cells in it. It just helps pull them in from the body. What are the outcomes with non-operative arthritis treatment? The vast majority of patients are able to delay or avoid the need for a joint replacement. While most joint replacements end up fine, there's always a chance of complication, and it is, as mentioned, a quality of life procedure. Knee injections have been shown to provide over 75% good to excellent results. The top pain management clinics in Colorado are Colorado Pain. They offer comprehensive pain treatments for arthritis at several Metro Denver area locations. Over 50 insurances are accepted by the board-certified pain doctors. The number to call for treatment is 720-306-9575, and visit us on the web today at painmanagementdenverco.com. I'm Dr. David Green with the Colorado Pain Network. Your pain stops here.